EMDR is different than talk therapy, especially if you're used to therapies that are very verbal or question and answer based. EMDR is focused on being more client controlled. You're going to share what you want to share, and it's focused on like a bilateral movement. And so for telehealth, it could be like a tapping or a following with the finger. And I'll ask you to visualize or think about what it is that you want to during that time period. And at the end, we'll do a check-in and I'll ask you what you noticed or observed. And you're going to share what it is that you want to about your observations during that time. What I ask is that you're honest about what came up for you. And you may not be comfortable sharing everything or have the words to share everything that you noticed. And it's just about learning to gain the insights and finding the way to describe it for you. And checking in about where you're at and how you're feeling as you go through that process of the bilateral movement. And it may seem a little bit weird if it's something that you're not used to, and you may not fully understand how it works or what it is that brings about the healing for you. But you'll start to notice some changes as you go through the process, and you just kind of trust the process and go through it with your therapist, and they'll explain more with you as you go along the way with them through the different stages.